A lot of your clients are getting ready to move. They want to be closer to their kids, to their grandkids. So there's a lot of things to take into consideration when your clients are moving, whether it's within the state or out of state. I want to talk about what happens with the deductible or the out-of-pocket that they've already paid. So Medicare Supplement Plan G, Plan N, they've already met their annual Part B deductible, and they change to another company. That Part B deductible went to the government, so they're good. They don't start over with a new deductible when they change plans. How about a Medicare Part D drug plan? Same thing. That goes to the government. If you've contributed towards it, that follows you to your next company. Now we get to Medicare Advantage plans. And I've been researching this for a long time, and I've come to the conclusion that there is no law, like there is in the other two instances, that makes them carry over your out-of-pocket max. I have found that it is a courtesy that most insurance companies, and of course I couldn't check all of them, but the ones that I called, most of them are extending the courtesy. So let's say I have company A and I've met my out-of-pocket maximum, and now I'm retired to Florida. If I go to Florida and enroll in that same parent company's plan, clearly it will be a different plan number, but they are extending the courtesy of letting me carry over my out-of-pocket max. Now, anytime something's a courtesy, that means they could stop that at any time. So I could never get any of the insurance companies to put anything in writing. The most they would say is, yeah, this is what we do, but we could stop doing that. I know that's not that helpful, but that's what your clients want. They want the truth, and sometimes the truth is gray. So you want to tell them that it's often beneficial that if they have company A and they're moving to Florida, that they move to company A again. Even though when you did the plan search, you found that another company would have better extra benefits. And you explain this to your client and you say, this company would have better extra benefits, but since you've already contributed so much to your out-of-pocket maximum, or maybe you've already hit it for the year, it might be better to stay with company A until the next AEP at least, so that you could take advantage of not having to start over with a new out-of-pocket maximum. This is where you can't point to it in writing. You can say it is a courtesy, and you might want to call that company to make sure they're still doing that at the time that your client moves, because it's subject to change. But that's valuable information if they are extending that courtesy, that I don't just go find them the most competitive plan in their new zip code. I stay with the same parent company that they had prior to moving. Now, let's talk about other concerns when you move. First of all, a lot of people don't understand with the Social Security component that they don't get more money or less money when they move from state to state. It's a federal program. Whatever they're drawing will just follow them. They need to keep their address up to date in socialsecurity.gov. Medicare Part B, again, federal, will be the same no matter where they go. The Medicare Savings Program, any type of benefits they're getting they're getting some kind of financial help, Medicaid, they're going to have to reapply in their new state. And a lot of people want to get ahead of that. I don't like to procrastinate. So I want to apply before I get there, but you can't apply while you're already getting assistance in this state. So I got to get to the new state and then apply, and you have to explain that process to your clients so they know it's not seamless. There's some bumps in that road. Now, if I have a Medicare supplement plan and I'm changing my state and I want to stay with the same company, the typical example I talk about is from a high cost of living area like New York, where Medicare supplements cost about triple the average Midwest price. And I want to move from New York to Florida, very common scenario. And they go, hey, I'm paying $300 a month in New York. I'm excited to move to Florida and pay $150. This is where you get to explain to your client that in order to get the preferential rate in Florida, in their new state, they have to reapply. They have to go through underwriting. Florida requires underwriting. So if they're healthy enough, they will apply and they will come in at a lower rate. But if they cannot pass underwriting, they don't have a guaranteed issue situation here. If their plan is available in New York and in Florida, because if it's not, that's a guaranteed issue. But if it is, then they will just get a blended rate. Now, a blended rate doesn't mean I move down to the Florida rate from the high New York rate. It means somewhere in between the lower rate and the higher rate, the insurance company will blend my rate. I'm not able to see what that math is. I call that voodoo math because everybody does it a little bit differently. The thing you need to know is that if they're moving from a high cost of living state to a lower state, they don't automatically get that cheaper rate. They have to go through underwriting if they want to come in at the lowest rate. So let's go back to the scenario where they have a small company that is not available in your new state. And we had several companies that stopped taking business and don't file plans in every state this summer. So if they're not available in my new state, when I move, that's guaranteed issue. Now, be careful on guaranteed issue business, because when it's guaranteed issue, oftentimes you do not get paid. In most cases, you don't get paid for your work. A lot of people are against completely working for free, and they will just tell their client, hey, I need you to go to this website, call this insurance company, tell them you want to enroll in Plan G. I'm not passing any judgment on people that don't want to work for free. We all got to pay the mortgage. Some people will do it anyway, just because of an accommodation for their client, because they know that they will get referrals from their client. A happy client will give them many referrals. So when I'm moving on Medicare Advantage, you're going to take into consideration if they've met the out-of-pocket max or not. So let's say they haven't met it at all. Then typically you're just going to do a new search. But it's hard for you to do your work when they don't have a new doctor. They don't live there yet. They don't know what hospital they want. And I have these clients every year, and I say, I need you to choose a doctor. And they go, I don't care. Just choose one for me. That is something that results in a lot of complaints to Medicare. One of the insurance companies told us something like 40% of all their applications did not have a primary care physician listed. And you'd think, well, they probably said, like my client said, I don't care. I don't go to the doctor. Just put one down. Well, then they get their ID card and it says Dr. I'll say Vivek Ramaswamy. And they're going, who is this? I don't know this doctor. And they get mad and they complain to Medicare. So we desperately need to work together with insurance companies to try to prevent complaints to Medicare. And this is an easy one. This is where you tell them, I need you to do some research or have your kids help you, or I can help you. Try to find a doctor that's accepting new patients, that's in the plan network of the plan we're moving you to. So that when I enroll you, and we can put this off for a week, that we can, with confidence, say this is your doctor. Now, you can always change your doctor later, but that way when they get that ID card, they're not shocked with some doctor's name that they've never seen. And remember, if you do not put a primary care physician on your HMO application, every insurance company will automatically assign one. So get ahead of that to try to keep your complaints to Medicare down. I don't want to harp on the fact that the insurance companies are really bearing down on complaints to Medicare, but they are. It's not an exaggeration. And you want to stay clean. You want to preserve your right to be contracted with all the carriers in your market. You don't want to get wiped out by one because you had too many complaints to Medicare. Again, even if they're unsubstantiated. One of the things you need to do is in your outreach to your clients is say, if you're getting ready to move, please contact me in advance. Because one of the horror stories I had in my career so far is, sadly, it was an insurance agent that his mom was moving from New York to be near him in Florida. And he said, Mom, when you get here, we'll take care of it. And she had a stroke the day she moved, a debilitating stroke that she will never recover from. And she was out of network. Of course, the emergency, the initial, was out of network, but then she had a lot of inpatient that was all out of pocket. Now, this could have been prevented if he would have moved her before she moved. If he had it set up so she moved at the end of the month, and then her coverage started on the 1st, and boom, she wouldn't have had all this out-of-pocket expense. So I try to tell my clients, you know where you're moving, you know when you're moving. Don't wait till you get everything all settled in to let me know, to help me change your coverage. I want to know in advance because I have some tips of the trade to help you. Number one being your plans will change on the 1st of the month. So I'd really like you to move closer to the end of a month so that it can start on the first of the month. That's great information for you to put in your social media posts and for you to put in your newsletters. When you're not talking about specific plan benefits or carriers, you don't need approval to convey that type of information to your clients so that you don't have to worry that you're going to steer away from the Medicare marketing guidelines. If you learned something today, please give us a follow. Rebecca and I would appreciate it. We'll be back next week.